Um, this lecture is entitled Codes of Ethics. We are talking about Codes of Ethics of Pharmacists. I tried to search a specific code of ethics of chemical pharmacists, but I have not succeeded in this search. So what about this code of ethics? The history seeing that it started with Philadelphia College of Pharmacy. It is 1848 is the first one, and then the American Pharmacy Code of Ethics started in 1852, and it is revised several times up to 1990. When we are talking about codes of ethics, we are talking about obligations and rights. Whenever it is the word obligation, this is a pure ethics. ايه اللي عايزينه منك؟ ايه ال perfect او ideal behavior that you are responsible for towards yourself, towards the patient, towards the community, towards the profession, towards the colleagues, and so on. And whenever there is the word right, this means it is a law. There will be punishment, there will be imprisonment, there will be a fine على حسب بقى الظروف، هل حبس، هل مجرد عقوبات مالية ولا لا. Who is the clinical pharmacist? He is the expert in using the medication in the healthcare team. This means he is going to evaluate the medication therapy, making appropriate recommendation to the patient or to the health practitioner. He may adjust the dose, he may consider the interaction between certain drugs, and so on. As I told my student in Faculty of Medicine, ethics is variable. Okay, it is varied according to the countries, according to the situations. Sometimes all over the time it is changeable. What is considered ethical before, sometimes it's not ethical nowadays. Okay, and vice versa. Okay, it's usually derived from the religion and laws. Why we are consider this ethical principle to be better, to make our life is better, our profession is better, and so on. Let us start with your obligation to your patient. Your initial responsibility is to doing your best for the patient. This means the best knowledge, the best skill, okay, for the well-being of the patients. You are providing him with proper drug, you are following him for any side effects or any drug interaction. This to improve his health life and quality. Your patient has the right to ask for your intervention or for your consultation as an expert for drug therapy. You are promoting the patient's entitlement to provide with safe, effective treatment. You ask for this. If you find something wrong, you will ask for a proper treatment for your patient. You are respecting the dignity of the patients, promoting the bioethical principles of the individual autonomy. And let us explain what we mean by autonomy. Autonomy is a Latin word. It is one of the basic ethical principles in medicine. Our basic principle is beneficence. You are doing whatever you are doing to the benefit of the patient. Non-maleficence. This means you are doing no harm to the patients. Justice. You are fair to all your patients. And fourth principle, basic principle, is autonomy. Autonomy, you are respecting your patient's wishes and decision in his treatment. يعني انت بتقول للمريض التريتمنت بتاعك كده، العلاج كذا او طريقة العلاج هتبقى كذا، and accept his decision وتوافق على اللي هو هيقوله. انت بتديله معلومات وهو اللي بيختار. So autonomy means it is the decision of the patient for his treatment, even if it is against the medical advice and even it is against the family wishes. Okay, this is the word autonomy. So your patient is involved in the decision about his health and about his treatment. Make a proper communication with the patients. This will humanize the relationship and facilitate your job and build up whatever we call a trust with the persons, even if there is different beliefs and values. The pharmacists provide treatment information to the patient. It should be trustful and suitable for that patient. You are taking joint responsibility with the patients as regard how he will take his treatment and medication, and if he has a side effect, how he can react, and so on. You are respecting the culture and personal difference. You are exposed to educated, non-educated, semi-educated persons. بتشوف ناس لها عادات وتقاليد مختلفة. ممكن تيجي تصرف له حاجة مش موافق، مش معتقد، هو سمع كلام عنها في الانترنت، سمع كلام عنها في التلفزيون من حد قريبه. احنا بنتعرض لمختلف الأفكار ومختلف الثقافات، وده موجود في معظم المجتمعات. يمكن مجتمعنا احنا أزيد شوية. أو لو هتشتغل بردك في بلاد عربية بردك culture مختلف، في بلاد أوروبية culture مختلف and so on. You are respecting this cultural difference if they are not violating upon the dignity and right of other person. Pharmacists safeguard the privacy and confidentiality of all the data of the patient. All his medical information and non-medical information. حد من العيانين دردش معاك، قال لك كلام، قال لك أسرار عن حياته، عرفت طبعا بتقرا الروشتة أو بتشوف الشيت بتاعه، بتعرف الميديكال كونديشن بتاعته. all this is confidential. ما بقفش اتكلم معاه عن مع زمايلي، ما بروحش عند أسرتي بقول الداتا دي، ما فيش الكلام ده خالص. and this is protected by law. لو أي مريض اشتكى إن أنت طلعت أو أفشيت سره، وهناخد احنا الجزئية دي بعد كده، you will be punished by law. A pharmacist places the patient's benefit before his own personal or professional or economic and commercial interest. طبعا في حاجات ممكن يبقى فيها benefits ان البيشنت ياخد دواء معين او ما ياخدش دواء معين and so on. طبعا احنا بنطلع بره ال conflict of interest. So this is your responsibility towards the patient. Now we are going to talk about the healthcare professionals and its ethical responsibility for you. You are keeping the professional skills and ability up to date. You are continuing education all the time. This is best for you and for the profession and for other parts of the team. You should avoid work-related practice, conduct, or condition which may be determined to independence, objectivity, or professional judgment. The pharmacists cooperate with colleagues and healthcare professionals, acting honestly with integrity to the professional relation, regardless the hierarchical relationship among them, and avoids unfair competition. احنا كده بنتكلم على وضع ideal مثالي. ما بتدخلش في صراعات مع زمايلك، ما بتدخلش في منافسات، ما بتحترم الناس الكبير والصغير and so on. ودي أعتقد إن هي الأخلاقية العامة. You should respect the authority and action of the colleagues and other healthcare professionals, even when the beliefs and values thereof differ from your own, provided that they are not violating the dignity and rights of the others. طبعا واحنا تيم ممكن اقول لك لا ده ما ينفعش، او لا ده مش مناسب، او انا الاكسبيرينس بتاعتي بتقول كذا. We are respecting الايه ال authorities وال actions of other personnel. If you are observing any violation to the ethical and legal standard in your healthcare team, just tell the responsible. لقيت أي حاجة مش مظبوطة، متجاوزة أخلاقيا أو متجاوزة القوانين المتعارف عليها، you should inform the responsible personnel in the team. You should sharing in research and in advancement of science in your specialty, and this work should be established within the ethical and legal standard. If you are going to be one of the professor and teaching activity, you have the duty to perform good teaching quality, make special mention to ethical principle, okay, in the pharmaceutical profession. So according to the ethical codes, what is your ethical responsibility towards society? You are responsible for promoting and preserving the improvement of health of the population. الحالة الصحية للشعب كله عن طريق awareness، عن طريق الميديكيشنز المظبوطة بنديها لهم، عن طريق إن إحنا بنعلمهم ياخدوا الميديكيشنز دي إزاي and so on. You should achieve an equitable allocation of healthcare resources on the basis of objectiveness, transparent criteria, particularly when the same are limited. موضوع الأدوية والأدوية البديلة وده غالي وده رخيص وبتاع، طبعا احنا بنحترم المريض، نشوف ايه الحاجة اللي تلزمه صحيا، بس في نفس الوقت بنحترم أو بنراعي الحالات الاقتصادية اللي احنا فيها. The pharmacists take part in care providing process in the purpose for the purpose of ensuring the safety and the process of furnishing information concerning the problem related to the drug therapy. What is your concern is the safety of the patient, and how to keep this safety by providing a good information about uses of these drugs. And you should join your colleagues whenever there is a corrective measurements and action to improve the outcome. بنحسن الحالة العامة، إن إحنا لو في إجراءات تصحيحية بنعملها، مهمتنا الحفاظ على سلامة المريض وصحته، إن إحنا بنديله معلومات كويسة عن الدراجز اللي هي بياخدها. You should respect the provision of law and regulatory standards. All of us, of course, respecting the law and the regulatory standards in each hospitals or each faculty. You should cooperate in modification of them whenever possible by your knowledge in scientific information, okay, to improve the outcome, and usually it is for the benefit of the patients. القوانين ممكن تتحط، احنا نحترمها ايوه، بس ممكن نشارك في تعديلها بما يخدم المريض وصحته. You are responsible for protection of patient, but still you have the right to objection to whatever you are seeing without harming your patient. من حقك الاعتراض، لكن طبعا بعد أخذ الاحتياطات إن ما يحصلش مشكلة في وصول الدواء للمريض. You are refraining or avoiding the contribution to any situation whenever they are using your skill or services against or in attempt on human lives or personal human dignity or human rights. الواحد ما بيدخلش في المشاكل اللي هي ممكن تؤثر على حياة البشر أو على احترامهم أو على حقوقهم الإنسانية، وما نستغلش في علمنا وسلطتنا. It is respectful, you are respectable the surrounding, the environment as regard the medicine, as regard the use of the policies for proper disposal to the waste and educating others in environmental protection. طبعا waste products اللي بتطلعها في الميديكال side بتبقى كتيرة بتبقى harmful to the society و harmful to the environment ولازم يبقى فيه proper taking care of it. Beside the patient, the professional healthcare, and the society, you are promoting the good of every patient in care, compassionate, and confidential manner. You are respecting the autonomy and dignity of each patient. You are recognizing the individual self-worthy by encouraging the patient to participate in decisions about their health واحنا شرحنا كام autonomy and doing a proper communication. You are acting with honesty and integrity in professional relationship, telling the truth to the patient, avoid discriminatory practice, don't be unfair, be fair to all the patients as regard the behavior and work condition which sometimes impair the professional judgment and actions that compromise dedication to the best interest of the patient. Maintain professional competence. Usually you are maintaining a good knowledge and skills, abilities to new medication and new devices, what is new in the field of your specialty. You are respecting the values and abilities of the colleagues and other healthcare professionals. We are not the same. ممكن كلنا نبقى متخرجين من نفس الكلية ممكن كلنا بيبقى لنا نفس التعليم but we are not the same. We have cultures, we have thinking manners, okay? We are different and we should respect each other and respect the ability of others. You are serving individual and community and the societal needs. And we are seeking justice in the distribution of health resources. Of course, we have a major problem as regards the finance and now the prices of any drug and medication and the medical devices is very expensive, and to keep safety of the patient and keep the good health of the patient provided him or her with the proper drugs, this necessitate that we should consider allocation of the resources we have. Thank you.